really these elements of cultural humility, it's certainly not something that has to be happening abroad. It's right here. Yeah. And how do you build that in, I guess, to the curriculum as it is today?
Well, a lot of what we have tried to do here is bring in people who can help us understand some of the vulnerabilities, as you've spoken about, in the community, because I think that's a really good word to think about, and a really good way to think about the building of cultural humility. So we have people who've basically lived in poverty here in our inner city. That's a cultural context in some regard, having to work so hard just for for survival, and we have people who struggle with addiction and with mental health issues, and so there are elements of their experience that become kind of like a cultural experience in themselves. There's no such thing as a culture of addiction, but they're living in a context in which they have to do things that the rest of us maybe don't have to do to survive. So understanding that, being willing to be receptive, and so we try to expose students to some of the other populations that we work with that we would consider to be marginalized or underserved in the community, through our education program, through our service learning opportunities, and we've got a number of community partners that have helped us to do that. But I think your discussion about being willing to acknowledge vulnerability is really important, both at home and abroad. And I think there are times that's what we need our students to be able to talk a little bit about, is when have you felt vulnerable? When have you felt that you really don't understand the context or what people are telling you, or the place in which you're maybe trying to deliver care? Going down to the Access Clinic, or working at Choices for Youth, or working on the swap van, or something like that, where you might be encountering people that have lived a different life than you and have had different experiences than you, and you have to be willing. You need that vulnerability in order for that humility to be part of it. And then the next step is thinking about the cultural safety piece, that we have to create a safe environment in which people in our community come in and seek health care. People have to feel that they're respected and safe, even if they are coming in from places that are not familiar to us. We think about people coming in from Labrador, or people coming from really rural communities, or people from our refugee population. They have to feel safe. And so part of cultural humility is also understanding how to create a culturally safe environment for our patients, and that they feel that you're willing to ask those questions. And